Hi, my name is Sheila Sandifer Cook. I teach Health Science 1 and 2 at South Pike Korean Technical Center. This is my 16th year. Uh, I have a master's. I have been nursing for 30 years. Today, we are going to talk about applying sterile gloves or putting on or donning sterile gloves. The first thing when you're donning or putting on your sterile gloves is that you want to at least wash your hands or use some type of hand sanitizer. And I teach the children that in healthcare, the only jewelry that you're supposed to have on is a wedding band. So I'm going to go ahead and remove my extra jewelry. I'm going to wash my hands with the hand sanitizer. Okay. Now these are sterile gloves. There's a difference between clean gloves that we use to get a patient a bath with or take and clean the patient up. Sterile gloves are gloves that we use in surgery. Sterile gloves are used whenever we have a break in the skin or the skin barrier because we do not want to introduce the body to some type of infection or whatever. So the sterile gloves, like I said, are different from the regular gloves. The regular gloves come in a box of approximately 100 or maybe 150, whereas the the clean gloves come a box of 100 to 150. The sterile gloves come one sterile pair per pack. And it has an expiration date, and these are expired because they are for training purposes only. If this date has expired, then these gloves are considered no longer sterile. So in healthcare, we would not use these gloves. So what I'm going to do now is open the sterile gloves, and I want to keep the gloves sterile. And as you will see that I have a 2-inch border around the gloves. Okay. Okay, this is your 2-inch border. That's considered non-sterile, so that's for handling. Okay, so you can touch that portion at all times or any time, as long as you do not touch the inside of your gloves. Okay, so I'm going to take my non-dominant hand, which is my left hand, and pick up my right glove. And I'm only touching the part that's going to touch the inside of my hand. That way, because that's going to be non-sterile anyway. Then I'm going to take the sterile hand. Sterile can touch sterile. And I'm going to go under the top glove. Go under. And I can take the sterile part and assist me to raise it up. Because sometimes in packages like this, they are stuck together. And take my dominant hand and apply the non-dominant hand. Sterile can touch sterile. Okay, if I have a problem, as long as sterile is touching sterile, I can apply the gloves. Now, these are the type gloves that we use in surgery. Doctor's doing a biopsy. If the doctor is going to remove some type of wound or change a dressing. Now, when you're changing a dressing, we're going to use clean gloves first to remove the old dressing. And then we're going to wash our hands and apply the sterile gloves because we have that break in the skin. Once we take and use the gloves for whatever we need to do, then we have a certain way for taking them off. We don't want to take them off and bite them, pull them off like you see some of the students do or that they start off doing. We'll take and go into the center of your hand, bring it together, go under so that your hand will not touch the other part of the glove. Wash your hands again with the hand sanitizer, and then you throw away all of your supplies. That's it.